Hi, and welcome to this session with focus on the epidemiology of cancer in HIV-positive persons. My name is Julia Bohlius. I am an epidemiologist based at the Institute of Social and Preventive Medicine at the University of Bern in Switzerland, and my research interests are cancers in HIV-positive populations. During this session, which will consist of two parts, we will explore the so-called AIDS-defining and non-AIDS-defining cancers, the causes leading to cancer in HIV-positive persons, the impact of antiretroviral therapy on the risk of developing cancer, and the changing pattern of cancer epidemiology we have seen in the last 35 years since the beginning of the HIV/AIDS epidemic. We will also discuss the need for vaccinations and cancer screening in HIV-positive persons. Rare cancer seen in homosexual. This article in the New York Times on July 3, 1981 was one of the first reports in the Western world pointing to what a year later was called the acquired immunodeficiency syndrome. As you can see, cancer has been a major problem in the HIV-positive population from its very beginning. This article already described several features which are typical for the so-called epidemic Kaposi sarcoma. Kaposi sarcoma is caused by human herpes virus 8, and before the HIV/AIDS epidemic, the so-called classic Kaposi sarcoma was a rare disease in the US and also Europe. With the onset of HIV/AIDS, Kaposi sarcoma became a frequent cancer in HIV-positive patients. Kaposi sarcoma in HIV-positive persons was more aggressive compared to the classic Kaposi sarcoma and occurred in patients who were much younger than patients who developed the classic Kaposi sarcoma. This figure shows standardized incidence rate ratios comparing cancer risk in HIV positives with the general population. Kaposi sarcoma, as well as non-Hodgkin lymphoma and cervical cancer, occur more frequently in HIV positive patients compared to the general population and are classified as AIDS-defining cancers. However, it would be misleading to assume that only these cancers have an increased incidence in HIV-positive persons. On the contrary, there are several other cancers which are not AIDS-defining, but which do also occur more frequently in HIV-infected patients compared to the general populations. These cancers are, for example, Hodgkin lymphoma, anal cancer, liver cancer, but also lung cancer. These cancers occur about 30, 10 and 5 times more frequently in HIV-positive persons compared to the general population. However, for some cancers, the risk in the HIV-positive and negative persons is about the same. For example, colorectal cancer and breast cancer, or even reduced, such as prostate cancer. With few exceptions, these cancers, which occur more frequently in the HIV-infected, are associated with oncogenic viruses. Human herpes virus 8 is the underlying cause of Kaposi sarcoma. Epstein-Barr virus is associated with non-Hodgkin's and Hodgkin's lymphoma. The high-risk variants of human papillomavirus are the causative agents for cervical, anal and other genitourinary cancers. Hepatitis B and C infection can cause liver cancer. In contrast, in those cancers where no increased risk is observed, an infectious etiology with viral co-infection has not been identified to date. Other factors relate to the so-called lifestyle factors, for example smoking, which increases the risk for lung cancer. The development of cancer is a multifactorial process. HIV itself mediates direct and indirect effects that causes cancer or promotes the development of cancer. HIV-induced immunodeficiency impairs the immunosurveillance of malignant transformed cells. In addition, the control of chronic infection with oncogenic viruses is reduced. Oncogenic viruses have been found in 70% of cancers in people living with HIV. In contrast, in HIV-negative patients, only 10% of cancers are tested positive for oncogenic viruses. As previously mentioned, lifestyle factors such as smoking increase the risk of developing cancer. Lastly, with increasing life expectancy, the HIV-positive population is now also getting older, and the increased age is associated with an increased risk of developing cancer. In summary, HIV-induced immunosuppression and co-infection with oncogenic viruses are the main drivers of the increased cancer risk in HIV-positive persons. I have now reached the end of part 1 of this lecture on cancer and HIV. In part 2, I'll tell you about the impact of immunosuppression.